What we need is not more medication, but more education, because the best prescription is knowledge. This is Exposé coming to you live from Lagos, Nigeria, every Monday on Instagram, YouTube, and Facebook simultaneously. I'm your regular host, Akinyemi. Don't forget, what we need is not more medication, but more education, because the best prescription is knowledge.
Hello and welcome to Exposé, brought to you by the Shepherd's Club International Church. I'm your regular host, Akinyemi. Today I decided to appear proudly Nigerian. You're welcome to Exposé, our Monday tonic, where we reveal, where we unveil, where we inform, where we educate regarding wellness and well-being. And today we are continuing in our series on medical systems. For those who have watched previous episodes in this series, we have talked about the various medical systems out there. Probably the most popular in this part of the world is allopathic medicine. Our conventional or orthodox doctors, nurses, pharmacists, physiotherapists, medical lab scientists, and what have you, constitute practitioners in that system. Most of the hospitals and clinics around this part of the world practice allopathic medicine. And every system, every medical system has got its own philosophies and underpinnings. But we have other medical systems like chiropractic medicine, osteopathic medicine, naturopathic medicine, homeopathic medicine, African traditional medicine, and Chinese traditional medicine. We have Ayurvedic medicine, we have Oriental medicine, and each of these systems have different approaches to addressing human ailments, and probably even animal ailments. And what we have done is to lay foundation in each of these systems, and we also promised we were going to be bringing practitioners in each of these systems, and those who also integrate different protocols from the various systems to create a hybrid that we know as integrative system of functional medicine. And we have brought several practitioners in the past on this platform. We've listened to people in osteopathic medicine, in homeopathic medicine, in naturopathic medicine. And we have even brought somebody who is a conventional medical doctor, but who is very, very passionate and interested in alternative protocols. And today we are honored to have yet another special guest in the house. Initially, when we started interviewing practitioners, we had all males. And some people were wondering, and there are females that are also involved in this business. And today we thank God we have yet another female, I think the third one in the series. We're honored to have her in the house. As we always say, what we need is not more medication, but more education. And I do believe that today's episode will bring some more information for your transformation, because we also believe that the best prescription is knowledge. For to be informed is to be transformed, and to be uninformed is to be deformed. When you have appropriate information, timely information, your options become many. And then you can prayerfully consider your options and choose wisely and look out for the best outcomes. So today, once again, we have another practitioner in the house who trained initially in the conventional or orthodox medical system, what you call allopathic medicine, and then eventually got interested in other modalities and now practices, integrative medicine. Like I normally do, I usually let my guests introduce themselves because they know themselves better than I do. So today we are honored to have in the house Dr. Mrs. Faith Okere. I hope I pronounced that surname correctly. She will pronounce it better for us, and then she will tell us more about herself. Now, you're welcome to Exposé today.
Thank you very much, sir.
It's an honor to have you.
Thank you, all viewers, for this opportunity. My name is Dr. Faith Okere.
Right.
I'm the Medical Director of Medics Wellness Consult Limited, Lagos. I'm a graduate of University of Maiduguri.
Lagos in Nigeria.
Lagos, Nigeria.
Because I understand that Lagos and other places.
Lagos, Nigeria.
Right.
And I'm a graduate of University of Maiduguri about 20 years ago.
Right.
And in my journey, actually,
what did you study at the University of Maiduguri?
That's the basic MBBS.
MBBS in Nigeria is the medical degree, what we call MD out there in other climes. We call it MBBS here. That's Bachelor of Medicine, Bachelor of Surgery. Right.
And initially, after my house job, I had an interest in obstetrics and gynecology.
Okay.
I actually went for my primaries, I passed my primaries, and I was geared towards obstetrics and gynecology.
Right.
But life turned things around.
Okay.
And I left medical practice for a while. And
we'll come to that. Why you left? Let's finish.
And then I came back by divine providence.
Right.
Actually, I have this issue, bone pains, right from when I was much younger in secondary school, and I was looking for a solution for that. Orthodox medicine could really not get to that. And somehow I got informed about water therapy, using structured water.
Right.
And I started investigating, and I decided to purchase that particular item that would create structured water for me.
Biodisc.
The biodisc.
Right.
And once I started, within 2 months, I discovered that the bone pains were gone.
Amazing.
And then I was working as a medical director in Fidelity Bone Clinic on the island. And I started
Lagos Island.
I started using that water therapy for a lot of patients, and a lot of ailments were actually going. In fact, they said that this doctor has this magic water that no matter what the problem is, and really for infertility, for fibroids, for arthritis, for hypertension. So then I really knew that nature is actually very, very powerful. So after that, I left there, and something happened. I started studying about medicinal mushrooms. And that was how my interest in integrative, because I said, if water, I discovered that the right kind of water can make a lot of difference in your life. And then started looking at nutrition and the rest. And I discovered that medicine can be better than what we know. It is a whole world. The human being is a complex, animal, let me use that word, that we really need to get to the basics, to the roots. And that was what prompted my interest. And with trainings here, locally abroad, it has opened up my mind. And it's really, really rewarding. What I practice is integrative medicine, which is a combination of the best practices from the Orthodox medicine and then complementary and alternative. I'm bringing it together for the holistic treatment of people. And it's really amazing because you see some patients that they've given up hope for. But when you treat them holistically, you find out that they will give them a new lease of life.
Right.
So integrative medicine is really going to the root cause of the disease and not just patching and treating symptoms. It's really more tasking, but it's more rewarding. And that's the medicine of, somebody said it's for the future, but right now it's the medicine of today. That is the reality. And a lot of doctors out there in Europe are now into integrative medicine, and the course is really, really expanding.
Right.
And the results are really amazing.
Good, you opened up this whole vista. I think it was the one-time president of the Rockefeller Foundation in New York who said many, many years ago, I think in the 1930s, if I'm not mistaken, he said, if the doctors of today do not become the nutritionist of tomorrow, then the nutritionist of today will become the doctors of tomorrow. That he was forecasting more or less. And I think that forecast has really come to pass in our time and in our day. You opened up many things. I mean, I had a list of questions I wanted to ask you, but some of the things you said I've already opened up, triggered some questions in me. The first one is I'm interested, and I know our viewers will be interested too. You said you left Orthodox medical practice for some time. We want to know what informed that and then what brought you back. That's one. And then you also touched on structured water. Incidentally, I talk to people and I tell them, you have to hydrate properly, but then the water you drink is also key. It's not just any kind of water. First of all, it has to be purified. I used to call it pure water, but people will misunderstand me. In this part of the world, they will think I'm talking about the one in sachet water. So I call it purified water now. In other words, all impurities are taken out, no contamination, no biological contamination, no chemical contamination. That's number one, the purity of it. Number two is the pH of the water. Number three, whether it has minerals or no minerals. And then four, the structure in particular. Because that determines the bioavailability. So we have the concept of dry water and wet water and all of that. You touched upon that, and I'm going to make you digress there a little bit before we come back to exactly why we're here today regarding integrative medicine or your medical practice. So tell us in a nutshell, what made you veer away from conventional medicine? What brought you back?
Some life experiences, some of them I really don't want to get into.
Okay, yeah, personal.
Apart from that, I later got into more of entrepreneurship.
Okay.
So entrepreneurship trainings and the rest, especially with the biodisc. Right. So it took me to a different path.
Okay.
So I was more like a consultant and a trainer.
Okay.
But
okay.
Like I said, because of looking for my own cure and some things, I somehow God brought me back to medicine, because when I was traveling out of the country here and there, I didn't have time for consulting. But somehow something was still missing. And when I decided to go back into consulting, it will be strange, especially in an environment, to just give people water. And they ask, what kind of water is this?
Is it holy water?
What kind of water is this? So I just felt that they need more than that. Right. And if you're looking at the structured water, because there's a Professor Masaru Emoto, he's late now, he was the President International Water Foundation for Life.
Okay.
He had a special microscope that they were able to examine waters from different parts of the world.
Right.
And they found amazing things. I have a 1-hour video on water that if you're watching it, you'll be wondering, are we still talking about this water? Water has memory.
Yeah.
Water has structures. You see most of the waters, especially in other countries, there's a lot of problems. They are seeing a lot of feminization in male fishes and some other things because they recycle their water.
Right.
I think here we are a bit lucky with some of those things, and we can get our water directly from the ground source. But from there, they found out that especially those that are on birth control, psychiatric drugs and all this, we pee it out, and this water is the same thing that is recycled. So at the end of the day, we are getting these chemicals back into our body, which is not supposed to be.
Right.
Now, when we talk about water, the purity, like if you look at our basic science, the pH of water is supposed to be neutral. Right. But a lot of the water we drink in today's world are actually acidic. We have a lot of tests. We tested them with a lot of brand names, 6, pH of 6.5, pH of this. And most of this water are heavy. Right. We find out that your body doesn't absorb this water. And that's why a lot of people resort to taking fizzy drinks, because that carbon dioxide gives them this false sense of hydration.
Right.
So but if you take your structured water, the surface tension of this water is reduced, so your body absorbs it easily. And you find out that water is still the best form of detoxification. Right. You find out that once you take it, your joints are all lubricated well, your BP start coming down. So taking the right water, we talk about the mineralization. Thank God for this good brand that we are seeing that was gotten from the aquifer.
Right.
The water is supposed to have some natural minerals. They're supposed to have a structure. They're supposed to have your cleanliness and water. And let us take, for example, in the villages those days, they had clean source of water. Once you're tired from your farm, you enter into the water, you feel refreshed.
Yeah.
And they take water in their clay pots. And they find that it's actually cool and refreshing.
Right.
But a lot of things have changed. We are not even close to water sources these days. We have pipes, everything. And then by the time it's going through long pipes in high pressure, it breaks down the structure of the water. So at the end of the day, what you're taking is not life water, it's dead water.
Right.
And so we have to go back to the basics if we really have to sustain life. Because our body is more than 70-80% of water. So taking care of that alone is critical for health.
We have ended up discussing water. We will not be distracted. We will come back to the main line. But you made some statements that trigger some other things. I'll come back to that after this break. Don't go away. We are going to be back. This is still Exposé. Dr. Faith is still on set. We'll be back shortly.
My name is Mrs. Damilola Olabimayowa. I am here to share my testimony about how I got recovered from given a death sentence to living days, months, years after. Before last year, I've been falling sick previously, and in and out of different hospitals. So later on, I was advised to go for a progressive test, which I did. And when I got there, they gave me the shocking news of my life, which was a death sentence, and I have just few days to live. The sickness are chronic hypertension, obesity, migraine. My kidney had a little problem. In fact, on that list was a whole lot I can't start explaining. That is what exactly brought me to this place to do the full training of the Module 1 and everything that it will take me to know everything I need to know to details about this elder living.
Welcome back. This is still Exposé, and I'm still your regular host, Tony Akinyemi. This is brought to you by the Shepherd's Walk International Church. We have with us today Dr. Faith Okere, who we are interviewing about integrative medicine. She trained as an Orthodox medical practitioner with a degree from the University of Maiduguri, Nigeria, Bachelor of Medicine, Bachelors of Surgery, and further trainings thereafter, and exposures and experiences in various quarters. And we started this conversation and we've been tending towards the area of water. Maybe that's the way God will have it today, because water is really critical to health. In fact, it is said that most disease conditions, particularly chronic degenerative diseases, have dehydration as one of the contributing factors. Or some other people, or in some other cases where people even deal with infectious diseases, or again contaminated water contribute to all of that. There are waterborne diseases, for instance. So the issue of water is key, and I'm happy that this is coming up today, and particularly coming from a medical practitioner. In the course of her conversation, she triggered a number of things in me, and that's why I'll be asking this straight question, which is personal to her, but I believe is of interest to us. You were saying when you left the practice of conventional medicine and then somehow you came back, you mentioned that that's the way God will have it. You brought in the God factor there. So I want to talk about your faith. What's your faith?
I'm a Christian.
You're a Christian, all right. What shade of Christianity? Because you know we have different brands out there. Just say point blank what it is.
Pentecostal church.
Pentecostal.
Actually from a Muslim background.
Oh, really?
Yes.
Right.
By God's providence, still, God brought me to Christianity. I'm a born again Christian.
Born again.
By His grace.
Spirit, tongue talking.
And by His grace, God has.
I understand you are even a worker, an elder, or a deacon or something. Deaconess, are you? Tell us everything.
I'm just a child of God. And as much as possible, I make myself useful where I am needed.
Okay.
But
That's the bottom line, yeah.
I prefer to just be in my quiet corner and do what God has sent me to do.
Good. You're welcome. We have answered that, by the way. Now, coming back to our conversation, you said you now practice, complementary and alternative, integrative. Those are words that I believe many people are familiar with. Maybe a few people are not familiar with them. Would you describe in a nutshell your concept of integrative medicine?
Yeah, like I said earlier on, integrative medicine is taking the best practices from both the Orthodox world and complementary alternative medicine. Now, the Orthodox world, like I tell people, allopathic medicine itself is not bad. When you have things like emergencies, there's a place for things like surgery, there's a place for some of these medical practices that are there. But one thing we were not really taught in school are basic things like nutrition, which is actually key, because we found out that majority of chronic illness that we have today are actually linked to nutrition and lifestyle, and that is not what we were taught. We are not really taught much of this in Orthodox medicine, but you get a lot of this training in the complementary and alternative, because especially when you grow in your specialization, they become very limited. You take maybe the eyes or the ophthalmologist, you just focus on the eye, forgetting that what happens in the body actually has an effect on the eyes. You just take your kidney and the nephrologist, forgetting that what really happens in the body is also pointing towards them. But when you look at integrative and functional medicine, we take the person as a whole. It's a whole from your head to your toe, what goes in, what is being absorbed, what is being metabolized, everything. So it's more a fulfilling kind of medicine. And then you look at what the person is eating as a nutrition, what are the toxins around you, what are your water intake, all these things actually have a part to play in your healthy well-being. So it's very important that we take both. And thank God, like we said, a lot of doctors are understanding the need of lifestyle change. Because if you look at our Orthodox, let's take for example hypertension, there's something we call a DASH diet. Usually, but how many of our doctors actually talk about that? The first thing, if a patient comes with very high BP, the first thing we start writing is a prescription, not even discussing the diet. And the problem is because we don't really know so much about it in Orthodox training.
You said that.
We are not really trained. We just have a few hours. That's the truth. But that's the truth. We have just a few hours of training.
You know why I passed that remark? It's because I'm a nutritional consultant. I trained as a nutritionist. Of course, my first degree is in computer engineering. And then my second one is in theology. And my third one is in nutrition. So I train in 3 different fields, completely unrelated fields. Now, as a nutritionist, when I give nutritional advice to people who are dealing with certain medical conditions, they go back to their doctors to tell them, a nutritionist told me this, and the doctor will just counter what I said and claim that he is the authority in that area, that what I said, they should just ignore it and all of that. And I wonder if you are saying that doctors are not really trained in nutrition, and yet when people want to ask nutritional advice, the first person they want to ask is their doctor, because they assume that the doctor must know everything. As long as it relates to health, the doctor must know everything. And I think the founder, or should I say the person who is actually recognized as the founding father of medicine, Hippocrates, actually said, let your food be your medicine, and let your medicine be your food. And he says, he who does not know food, how can he know health? Okay, so this brings us to the issue of medical training. I know if we want to trace the history of medical science and the curriculum of medical schools, we discover that there has been some influences that have influenced the curriculum. Originally, there used to be a lot of nutrition in medical training, but gradually that began to, diminish until it became almost chemical oriented. But now I'm glad that things are beginning to take another turn, and doctors like you are giving us some things to smile about. Letting us know that we have to take care of the totality of the person and not just look at symptoms and see how we can mitigate symptoms. Thank you very much for bringing that dimension. Now let's come back to your practice as a person. You mentioned that you are the medical director of your practice. Can you give us the name of your practice one more time?
Medics Wellness Consult Limited. That's the name of my practice.
Medics Wellness Consult Limited, and it's based in
Lagos.
Lagos, Nigeria. All right. At the end of the day, you give us your contact, your website, your email address, your telephone number, WhatsApp number, whatever. But before then, I want us to look at, this is basically from my layman's point of view, not as a medical doctor, but as a layman, can be divided, broadly speaking, 2 categories: the chronic degenerative ones, and maybe the acute ones that just come short and sharp, and they can be dealt with there and then. But there are those conditions that conventional medicine regards as incurable, so to speak, but they can be managed. In other words, the patient can be helped to coexist with that condition for the rest of his or her life, and properly managed so that both of them can live together, one not hurting the other, for as long as possible, until one of them one day will say, no, I'm no longer going to be contained. and then they rear their ugly heads. Chronic degenerative diseases. I want us to look at that in particular, how integrative medicine can be of great help to those who are dealing with chronic degenerative conditions. First of all, help us mention names of conditions that fall into that category, and then tell us how people dealing with such conditions can benefit from integrative medicine, looking at it from both the preventive and the curative perspectives.
Okay, thank you very much, sir. Talking about the chronic diseases, there are different ones. Arthritis,
Okay.
Hypertension, your diabetes, your cancer, your heart diseases, among others. And these are like the common ones that we have in our environment. Orthodox medicine really do not have cures for these diseases. They tell you have to, if you're hypertensive, you have to be hypertensive for life and stuff like that. But what I have come to realize is that there is no disease that your body cannot cure if given the right items, if given the right materials.
Building blocks.
Building blocks. Your body has the ability to heal.
An inherent capacity.
Yes. It doesn't matter the name of the disease.
Okay.
And we've also found out that, okay, let's take for example arthritis. Like we talked about it, a lot of these diseases are linked to lifestyle.
Okay.
Arthritis, most patients are dehydrated.
Right.
Most patients are constipated, so they have a lot of acidity in their body, you know, and most of these people, if you look at the food that we are eating these days, most of them are devoid of some of these crucial nutrients that we need. And so your body is undergoing a degenerative process.
Right.
But when you are now looking at it from a functional point of view, like some people that have arthritis, they have some vitamins that are low like magnesium, we have things that are low like vitamin D3, you know, and some of these other silica and some other ones.
Right.
So by the time you're able to give your body what it needs, you know, like things like your glucosamine, chondroitin, vitamin D3 and all the rest, and then water therapy. But I found out that even water therapy alone, the good water, not the dead one this time around, the good water can cure more than 50% of arthritis. There was a client I had, her mom had an issue. Suddenly they said she couldn't walk. I was like, what happened? She went to Igobi and they were like, no, she needs to come in for spinal surgery or something like that. And I told her, I said, no, for 3 days, let her start taking the water, the alkaline water that we know.
Okay.
Let her take a whole lot of it, at least 3 liters in a day. And by the second day, this woman was up and going. All the pains that she had at the back that she couldn't walk, everything disappeared. So the truth is that the water you take, like I said, our body is mainly water. If it's able to lubricate most of those joints, it will help you. And then the remineralization, by the time you give your body what it needs, your body has the ability to heal. And what we normally do in orthodox medicine is to give steroids in the joints. But right now in functional medicine, there's something they call prolozone, which is ozone and, you know, procaine and this, and it helps. And there's some other minerals like your B6 or B2. It actually helps in regenerating the joints. So the joints can actually heal.
Okay. Is prolozone available in Nigeria?
Prolozone is available. Not many doctors are doing, but prolozone is available in Nigeria.
In your clinic?
In my clinic is available. And some other clinics. But it is very, very effective. I
have 2 friends in Florida who have clinics. They are Caucasians. And one of them offers prolozone. And that's where I refer people to. I never knew that it's here in Nigeria now. Wow. This is interesting. Anyway, we will have another short break here. And then we'll be back to continue this conversation around chronic degenerative diseases and how integrative medicine can be of help, both in the prevention and in the curative. Don't go away.
My name is Mrs. Damilola Olabimayowa. I am here to share my testimony about how I got recovered from given a death sentence to living days, months, years after. Before last year, I've been falling sick previously, and in and out of different hospitals. So later on, I was advised to go for a progressive test, which I did. And when I got there, they gave me the shocking news of my life, which was a death sentence, and I have just few days to live. The sickness are chronic hypertension, obesity, migraine. My kidney had a little problem. In fact, on that list was a whole lot I can't start explaining. That is what exactly brought me to this place to do the full training of the Module 1 and everything that is to take me to know everything I need to know to details about this elder living.
You're welcome back. This has been Exposé, brought to you by the Shepherd's Flock International Church, and I'm your regular host, Tony Akinyemi. Today we have in the house Dr. Faith Okere, who practices integrative medicine. She trained as an Orthodox medical practitioner, but she has been experienced and trained in various other modalities, and she operates a clinic right here in Lagos, Nigeria. Some of the things that were only available North America and Europe, Asia, are now available in Nigeria, thankfully, and her clinic is one of those centers where such modalities and protocols are available. She just mentioned one for arthritis. There was a particular lady that had a very bad one on her two knees. In fact, an elderly lady, it was so painful, so excruciatingly painful that tears would be rolling, down her eyes. I felt so much for her. We did the best we could nutritionally, and I had to also suggest, because they could afford it, to go to Florida. Now they don't have to go to Florida. They can come to Dr. Faith's clinic to get treated with that. That's very heartwarming. Now we're going to continue this conversation around these chronic degenerative diseases. You mentioned hypertension, you mentioned diabetes, you mentioned arthritis, but you dwelt a little bit on arthritis. Can you progress a little further into the other ones?
Okay, now let's look into hypertension.
Right.
Like when it comes to hypertension, there are some basic deficiencies that some patients have. But most of them, they could have low potassium, they can have low magnesium, they can also have low vitamin D3, and then they could also have some other ones. But basically, these are some of the ones that we see. And when you give our Orthodox medication, we have not solved these underlying deficiencies.
Right.
So after a while, these drugs stop working, and they have to add extra. They have to keep adding extra.
And after some time, there's habituation.
Yes, and apart from that, the complication of the disease continues to progress because we have not really dealt with the root cause of the problem.
Right.
But when you take things like that, if you have deficiencies in this one, supplement it. Even without doing any other thing, you find out that their BP actually starts coming down. Now, for those that have sometimes maybe they place them on statin medication, we find out that the statin can actually reduce the coenzyme Q, which is also going to cause another issue for them. So, but by the time you are able to place these patients on your coenzyme Q, your cotton bed, which is a heart tonic, and then place them on normally we don't even stop their Orthodox medication. But the truth is, by the time you're on this natural medication, after like 6 to 8 months, and then your nutrition too, which is your diet, things like beetroot has nitrous oxide and can help your BP to fall. And by the time you're on this thing for like 6 to 8 months, you just discover that your BP has been regular. And even when your doctor is the one that's supposed to take you off your medication, you find out that the blood pressure is no longer coming on.
Right.
And sometimes you need some chelation therapy, especially those that have atheromatous plaques in them. We call them chelation therapy using calcium EDTA, and some of these things actually are available to clean up the vessel. Right. And we tell people cholesterol is not the major problem. We have so much held on to cholesterol. Cholesterol is really not the bad guy. There's a lot of processes that cholesterol is like it's like a cement that is trying to help to plug your damaged vessel.
That's right.
So by the time you're able to sort out all these things that your body needs, you find out that the flow just improves, and everywhere you find that the BP is actually gone.
Microcirculation
improves.
And a lot of deficiencies in the extremities, they all disappear. We actually did an episode. I did an episode on cholesterol. I think 2020. And all these things you are saying, you are just confirming and corroborating some of the things that we said at that time. Because cholesterol actually has more than 7 vital functions in the body, and when a person is deficient in cholesterol, can actually lead to several other problems. And people have given it such a bad name that when they hear chole, they run. Thank you for bringing that up again. So now she has talked about chronic degenerative conditions like arthritis, like hypertension, like diabetes, like cancer, and what have you. And there are modalities and protocols for addressing all of them using the best of 2 worlds. Whatever is applicable and relevant in conventional medicine, as well as alternative medicine, nutritional medicine, and herbs and supplements, vitamins, minerals, and other things, even as simple as water or simple as oxygen. All of these things come together to bring about the best outcome for patients. Or she calls them clients. I mean, I heard her say clients when she was talking. Some other people call them partners. Whatever it is, it's nomenclature. We mean the same thing. People who are needing health transformation, who want to improve their well-being, people who are on their wellness journey. They want to move from point A to point B, and they need a coach to come along to guide them and help them to be able to do well on that track. And doctors, by the way, are essentially coaches, because the word doctor actually means teacher, means a coach. And we thank God for them. We appreciate what they do for humanity. We have Dr. Faith in the house. She's been talking to us about chronic degenerative conditions. Now, Dr. Faith, I'm going to be asking, what are the unique diagnostic tools available in integrative medicine that are different from what we are familiar with in Orthodox practice? For example, in Orthodox practice, you go there, X-rays are there, mammography is there, blood work, and different kinds of things. The ones that are overlapping, I don't want you to talk about those ones. In other words, there are such that are used both in Orthodox and in alternative. I don't want you to talk about those. I want you to talk about those diagnostic tools that are deployed in alternative medicine that are not necessarily used or even recognized in Orthodox medicine. Right.
Thank you very much, sir. One of the major ones that came to my mind is something we call live blood analysis.
Right.
I first came across this like 10 years ago at a clinic in Dolphin Estate in Koyi.
Oh, in Nigeria, here.
Nigeria.
My first experience was in 2005. About 16 years ago. That was in North Carolina when they did one for me, and I looked at it. This is my own blood. In fact, I saw red blood cells, I saw white blood cells, I saw, in fact, I saw a fungus.
It actually shocks you.
I mean, I was looking at it and I said, in my body.
Because the truth is, the training I did, it actually opened my eyes to a lot of things. We did a live blood and we did a dry blood oxidative test.
Okay.
Normally, most clinics they do the live blood, but this was a very intensive training. So, you know, they talked about what is going on in your body has to do with the biological terrain.
Right.
No matter the name of the ailment. Like we said, most of the chronic degenerative diseases has to do with acidic terrain.
Right.
So when you do a live blood test, you will see your normal red blood cell, you see your white cells, some of them are abnormal. Then you will see a lot of degenerative changes. Sometimes we see fibrin,
right, clumping, everything together.
Yes, clumping, rouleau formation in material. So you see that rouleau, and then there too, it also shows a lot of oxidative stress on the something, and then acidity of the body. Then sometimes we see parasites, we see some broad bacilli running around. Then you're wondering, is this really my blood? And we see things like sometimes fungus. We see them as yeast formation, fermentation around the cells, and then also when we look at the dry blood, you see things like leaky gut syndrome. You see something which is very common, but which is not recognized in Orthodox medicine. But in functional medicine, that syndrome really exists. A lot of people that have asthma and autoimmune diseases and what have you. What they have is a leaky gut, because more than 80% of diseases, there's a problem in the gut. So we really need to start the healing from the gut. So these are some of the things I can pick up. There are other things like sialic acid, which also shows degenerative changes. There are things that when we see systemic disorganization, even if the person is not complaining of cancer, we said there's a high possibility. Now this test is not a diagnostic test.
Right, it's just
a screen and give you peep into what is going on. And we say, look, these are most times when you go and do Orthodox, it's confirmed that something really is there. So it really opens your eyes to a lot of things. The live blood analysis, it's a beautiful test. And most functional clinics I attended when I traveled, they actually have it. So it's one of their core things.
Which countries have you traveled to for these experiences?
Like Germany.
Still counting?
That's what comes into my mind for that.
Okay. Alright, so they've been signaling to me that our time is up. But before I let you go for today, obviously when you come back for the next episode, you already told me that backstage before we came that you're going to have to do another episode with us, because we may not be able to cover all of this in one. When you come back in the next episode, you'll be telling us, breaking it down, those different protocols, you break them down. I mean, testing, diagnostic testings and what have you, and explain them in details. But what I want you to do right now is just list them. Just, tell us 1, 2, 3, 4, 5. Don't explain them, just mention them. We have mentioned live blood analysis. Okay.
We also have a thermography.
Thermography, which is the alternative to mammography. Is that so?
We wouldn't call it alternative.
Right.
But it's an earlier screening test.
Before mammography. We will discuss why it gave way to mammography, because I know the politics of medicine sometimes. But so we have the mammography here.
Then there's something we call the functional blood chemistry analysis.
Okay, different from regular blood tests.
Which is bringing your blood test together but analyzing it from the functional perspective.
Okay.
It gives you a lot of insights that you would have missed when you're looking at it from the Orthodox view.
Okay, so you will explain that better in the next episode. So we have the third one now. Is there
then we have the undermed.
The undermed, that's another one.
Which is also diagnostic and therapeutic.
Okay, good.
So for diagnosis, I think that is
essentially what is different. Sometimes you also use some of the conventional diagnostic tools. Yeah. So everything is brought together, the whole essence of integration.
Yes.
Good. Before I let you go today, our viewers will again like to know how to contact you. So whatever information that is useful for them in that regard, I'm sure they'll be glad to have it. Your telephone, website, email address, WhatsApp number, house address if you wish.
Okay, the name of my clinic is Medics Wellness Consult Limited. We are at New Okoba, Lagos axis, and the contact phone number is 080-5518-0507. It's best to always send a WhatsApp message. An alternative number is 081-82-796-721. So you can try to contact any of this number if you have any other questions or comments, or to book an appointment, because it's an appointment-based clinic.
You really come across like a Igbo. So everything is done that way. I think that's the way to go, really. So we want to say a big thank you for this first episode, and we're looking forward to the next episode, where we will dive in deeper into those modalities you mentioned and others that you were not able to mention because of time. Viewers, we want to thank you for spending your evening with us again on Exposé. This has been brought to you by the Shepherd's Club International Church, and I'm your regular host, Tony Akinyemi. Don't forget, what we need is not more medication, but more education. For the best prescription is knowledge. Do have a very pleasant evening today. God bless you, and bye-bye.
My name is Mrs. Damilola Olabimayowa. I am here to share my testimony about how I got recovered from given a death sentence to living days, months, years after. Before last year, I've been falling sick previously, and in and out of different hospitals. So later on, I was advised to go for a progressive test, which I did. And when I got there, they gave me the shocking news of my life, which was a death sentence, and I have just few days to live. The sickness are chronic hypertension, obesity, migraine, my kidney had a little problem. In fact, on that list was a whole lot I can't start explaining. That is what exactly brought me to this place to do the full training of the Module 1 and everything that is to take me to know everything I need to know to details about this elder living.